Namaskar, hello and a very warm welcome viewers. You're watching Bills and Insight, your one-stop destination for views, news and analysis of proposed legislations of India that have far-reaching implications and impact your life. I'm your host Kriti Mishra, and today the spotlight is on the Commission for Air Quality Management in the National Capital Region and Adjoining Areas Act. President Namrata has given his assent to this bill on air quality management. The Act provides for Commission for better coordination, research, identification and resolution of problems related to air quality in the National Capital Region and adjoining areas. And before the detailed analysis, let's take a look at the highlights of the Act. In matters of air pollution and air quality management, the Commission will supersede all existing bodies. It will have powers to issue directions to the states. The Commission will have powers to restrict the setting up of industries in vulnerable areas and will be able to conduct site inspections of industrial units. If its directions are contravened, the Commission will have the power to impose a fine up to 1 crore and imprisonment of up to 5 years. So why did we need this Act? The monitoring and management of air quality in the Delhi NCR region has been done in pieces by multiple bodies, including the Central Pollution Control Board, the State Pollution Control Boards, the state governments in the region including Delhi, Haryana, Uttar Pradesh and Rajasthan. They in turn are monitored by the Union Ministry of Environment, Forests and Climate Change and the Supreme Court, which monitors air pollution as per the judgment in MC Mehta versus Union of India case in 1988. The Act, however, creates an overarching body to consolidate all monitoring bodies and to bring them on one platform so that air quality management can be carried out in a more comprehensive, efficient and time-bound manner. Apart from consolidating all agencies, the Commission has replaced the Supreme Court-appointed Environment Pollution Prevention and Control Authority, which was there for the last 22 years. And to discuss the impact of this Act, I'm joined by an illustrious panel of guests. Joining us through virtual platform, Dr. Sachchida and Tripathi, Professor, Department of Civil Engineering, IIT Kanpur. He's also the member of the NCAP Steering Committee, Ministry of Environment, Forests and Climate Change. Dr. Vivek Nangia, he is Principal Director and Head, Institute of Respiratory Critical Care Medicine, Max Hospital. Mr. Polash Mukerjee, Lead Air Quality and Climate Resilience, India Program, Natural Resources Defence Council. And also joining us, Dr. Ajay Nagpure, Program Head, Air Quality, WRI. I welcome you all on Sansad TV and thank you so much for joining us. And before we commence our discussion, let's take a look at how our parliamentarians debated this bill.
Farmers should be educated, farmers should be enlightened, farmers should be trained to know what is the bad side of stubble burning. This bill includes representatives from crucial ministries. However, it appears that the government has taken a more scientific approach to air quality management instead of a scientific social approach. It is more a social problem, sir.
Agriculture, the manufacturing industry, then services industry and the infrastructure. All the 4 areas are contributing predominantly to the air pollution of this region. About 150 kilometer radius of Delhi is the major air pollution creating location. So this need to be certainly addressed. This bill is coming out with all the relevant points to address this.
I compliment the Honorable Minister on assuming charge. He has come out with a bill which will definitely clean up the air quality, not only for Delhi and surrounding areas, but I would request and ask him to consider air quality, be it in Delhi, Mumbai, Chennai or in some remote area, has been deteriorating. So air quality should be part of healthcare.
एक लंबे समय से दिल्ली में विभिन्न न्यायालयों के निर्णयों के कारण एडहॉक कमेटियों का निर्माण किया गया था और पिछले कुछ समय में जिस प्रकार से दिल्ली में वायु प्रदूषण हुआ था और वायु प्रदूषण का जो कारण है वो केवल दिल्ली नहीं बल्कि दिल्ली के आसपास के एनसीआर क्षेत्रों में चाहे वो ट्रांसपोर्ट हो, उद्योग हो या अन्य कारणों से वायु प्रदूषण का विषय हो, उसके कारण एक ऐसा समन्वित, एक इंटीग्रेटेड इंस्टीट्यूशन बनाने की आवश्यकता थी, जिस इंटीग्रेटेड इंस्टीट्यूशन के माध्यम से हम लोग एक ऐसी व्यवस्था का निर्माण कर सके जिसके लिए इस वायु प्रदूषण के लिए हम एक संस्थागत स्वरूप दे पाए।
And Dr. Nagpure, let me begin the discussion with you. The Commission is an attempt at creating an umbrella body. The provisions of the Act will remain supreme in case of any conflict, either between the state governments or the pollution control bodies. How do you assess the impact so far of this Commission?
I feel this is a very welcoming move, because for the managing air quality, I think there are a lot of institutions are working. And this act would, I think, reduce those institutional barrier and improve the communication efficiency. That is the most important thing for implementing the air pollution mitigation strategies. So I think this would be going to be help to efficiently manage the air quality of North Indian region.
All right, so there'll be better coordination and communication. That's what you're telling us. Dr. Tripathi, initially the Commission for Air Quality Management Ordinance was promulgated, but the bill to replace the ordinance was not passed in the last budget session of Parliament, as a result of which the Commission ceased to operate in March 2021. Subsequently, a second ordinance was brought in April 2021 with modifications due to the farmers' protests. What were the changes proposed, sir?
I first agree with what Dr. Nagpure said, that it's a very welcome bill. It's a significant legislation, as you mentioned, that overarching, that would help basically a better coordination of different agencies, not only regulators, but all the adjoining state boards and also other stakeholder ministries. And we have first time realized that and recognized that the problem of pollution in NCT is a regional problem, and we require an approach. What we know and we'll discuss subsequently is an airshed approach to tackle with this problem. So the Commission is right there where it actually has started working in that direction, and hopefully I think we'll have a much better demarcation of the airshed of Delhi NCT and NCR, and whatever the subcommittees of commissions are in place would take decisions keeping in mind that airshed approach to tackle this problem. It is true that the first ordinance lapsed, because I believe that most importantly, that time Parliament was not in session, and you have to have basically the ordinance needs to be passed in Parliament within 6 months. That was one reason. And secondly, I believe that definitely when some kind of punitive measures need to be taken against a particular community, you need to have the interest of all stakeholders protected. And I believe that the revision has happened in order to protect the interest of all stakeholders.
So the interest of all these stakeholders, that must be kept in mind. But there's a larger issue, Mr. Mukerjee. The farmers from Punjab and Haryana grow rice in Kharif season and wheat in the Rabi season, and hardly get time to remove the stubble from rice before sowing wheat, and hence they prefer to burn it. The biggest question is, how do we change this rice and wheat cropping pattern?
Well, thank you for that question. I believe crop residue management is a larger issue that needs to be discussed extensively before solutions can be found. And much of the discussion has taken place over the last decade or so. The solutions lie in two domains: ex situ and in situ management of the residue. I'm happy to see that the government has increasingly been moving towards ex situ solutions, and earlier this year there have also been the necessary notifications for the use of this stubble in power plants, in industrial boilers as fuel. So essentially the solution to this problem is twofold: ex situ, like I mentioned, and in situ will require resolution of utilization and processing of the stubble in the field itself. Along with this, what you just mentioned is crop diversification. That would require a more long-term approach where this region is moved gradually away from the exclusive cultivation of paddy.
Absolutely. So crop diversification is going to be very, very crucial. But talking about the impact on our health, Dr. Nangia, we see a spike in patients every year when pollution levels are high. And the future challenge for hospitals will be to deal with patients with both long-term complications and short-term problems. Are we ready for it, sir?
Yeah, so basically, I think we need to understand that air pollution has been labeled as the single most hazardous environmental risk factor on our health by none other than the WHO itself. It's also been called as a silent or the invisible killer, but we see that it's quite visible to us during the winter months when there is smog around us. It becomes so hazy at times. The visibility is so low. You have to see that in 2012, it accounted for nearly 7 million deaths globally. That was about 1 in 8. Then in 2015, this number rose to about 9 million deaths, and out of which 1 in 6 deaths were being labeled attributable to air pollution. In India alone in 2017, there were 1.7 million deaths that occurred. The impact of air pollution is very significant and very severe. It depends on the size of the particle that is impacting you, actually. So if it is a size above 10 microns, that would usually cause some watering from the eye, simple cold, sore throat. That's it. A particle size 5 microns and less would actually go inside your lungs and can trigger off a cascade of inflammation inside. Whereas a particle size less than 1 micron, or even these toxic gases that are there in the polluted air, could actually have a direct access into your bloodstream. The times when the air pollution levels are very high and there's a significant exposure, the number of people coming in with acute exacerbations of COPD, asthma, heart attacks, they go up by nearly 20%. Those are the acute reactions to the air pollution. Then there are the chronic changes, the long-term impact that it can have. In a long-term basis, it could also result in lung cancer. There's something called a hypersensitivity pneumonitis, and it could result in premature deaths, as I've already highlighted. In pregnant ladies, it could start with intrauterine growth retardation, impact on the child as the child is born. Once the child is born, the child could have respiratory allergies, asthma, frequent lower respiratory tract infections. Some children even go on to develop mental retardation because of the exposure to lead. So, there's a whole gamut of diseases that can be precipitated or triggered off by the air pollution. Now, the question is, are we prepared or not? Well, we are prepared, but the problem is that every time this happens, there is certainly a rush and pressure on the hospital beds as well. And as it is, we are facing that around this time around the winters, usually the COVID numbers also start rising. Both the years, if you see, the COVID numbers are also on the rise. So COVID and air pollution both can be very lethal to many patients.
Absolutely.
Presence of air pollution also, the impact of air pollution results in an inflammatory cascade in the lungs. This inflammatory cascade would weaken the immune system, making an individual more prone to developing COVID infection. Not only the numbers rise, but also the complications rise. So there are a larger number of patients who would develop a COVID pneumonia and may require oxygen and ventilatory support. So there is a huge impact that air pollution causes on our health.
All right, so the health impact is very, very serious and we need to look at sustainable solution. But moving on, Dr. Nagpure, the Act takes into cognizance the airshed approach as the government realized that Delhi's air cannot be managed by activities confined to Delhi. The airshed approach is always good compared to looking at political boundaries, as air travels beyond political boundaries and the crisis also happens beyond political boundaries. Help us understand the concept of airshed approach.
I think when we say airshed approach, so we know that air moves from one place to another place. And when we talk about the airshed approach, means like the maximum amount of pollutant it's caused by a particular region. For example, when we are talking about North India, so there are scientific models, there are methodology which first estimate the contribution by different administrative boundaries, then applied into the models. And those models, scientific model or air quality model, tell us like how much pollutant is coming from which are the places. So based on that, if the maximum pollutant is coming from a particular region, so we consider it as a air shade. For example, 2-3 states are contributing 80% of the air pollution in that region. So we consider 3-4 states as an air shade area for that region. So for example, in North India, Rajasthan, Haryana, Punjab, Uttar Pradesh, these are the major states which are contributing a lot of air pollutions. So this is how we define air shade.
All right, but Dr. Tripathi, the question is, how can the western disturbances that affect the atmospheric change over entire northwest India and have a major bearing on the region's weather be accounted for in this regional airshed model?
That's actually is a very good question. And before I answer that, I just like to add a little bit more on this legislation, which you quite well, listed that there are three major components of this legislation. And one part which probably we need to note that true, that Commission's jurisdiction applies to Delhi NCR and adjacent regions, but it also can be challenged in a National Green Tribunal. Now, there I have a very, humble suggestion that many times we need our own, that the Commission needs its own legal way, which is currently is not explicitly stated as a part of, the three committees what you mentioned earlier,
yes.
So that these legal people can always go and defend Commission's decisions or Commission's jurisdictions, which probably could be challengeable or could be challenged in NGT, because many times we have seen that our scientific staff, engineers, and other officials from state boards and from states actually spend a lot of time in defending or basically presenting themselves in NGT. Now, coming back to your question that how these large-scale meteorology could play in probably creation of what we call a very stagnant or suffocating kind of situation over entire this belt, which runs from across the border, Punjab, and right up to good part of Bihar or even beyond. That mainly what happens that is this time when you have WD, then basically there is a large scale subsidence that happens. And this would basically bring the boundary layer further down. It can bring boundary layer very close to surface, which is called, basically we call it the mixing height, which if you have a deeper mixing height, it allows better dispersion of pollutants. But during WDs, because of this large scale subsidence, the mixing height can be reduced significantly, and that would not allow the pollutants easily to disperse, or in other words, what we call, it reduces the ventilation coefficient of atmosphere. And that is what, there is this natural thing which acts against dispersion of pollutants in this entire what we call Indo-Gangetic basin. So therefore, as what pointed out by others on the panel, that the Commission sets the tone right, the way we need to have this overarching body, which has all the stakeholders as a part of this, all the political, the state governance, the other agencies, but we also need to think about some other ways, which I have always argued for similar regions in other part of the world, where the topography and meteorology, the natural factors are against you. You have no control. And that is what happens right from October to the good part of January. You need to step ahead. You need to go beyond the problem. You need to think ahead. One way is to look into that is to have a different set of emission laws for this region. This has been done in other regions, in other countries, which have a prolonged problem of air pollution. So they had a set of emission laws for one part of the country, and other regions where meteorology and topography were acting against it, they had a different set of emission laws. This seems to be a difficult proposition for now.
Absolutely.
But this is something probably is good to start thinking, and that's something Commission may, or it would augur well for the Commission if they start thinking about it.
So we'll have to wait and watch how that situation emerges, sir. But you mentioned about the factors that are beyond us. On the other hand, Mr. Mukerjee, there is a need for the massive augmentation of intra-city public transport and to move industries, power plants and other users away from polluting fuels like coal to natural gas, electricity and renewable energy to ensure clean combustion. That certainly is a very big challenge.
That's right, Kriti, and I think it only adds to what Dr. Ajay and Dr. Tripathi have also spoken before me about the challenges of regional airshed level air quality management, where you have to coordinate with multiple different political jurisdictions as well as executive authorities across political boundaries. And that is where the CAQM comes in with its greater significant powers, much more than that of its predecessor, the EPCA. It has the statutory powers, and like you said, it's the apex authority.
Yes.
It's been created by an act of the parliament. It can supersede other state government directions, including the central government directions as well. So it has the authority, A. B, it is also staffed with full-time members over and above the ex officio members that such committees usually are populated with. This means that for the first time, there is an authority that has the statutory power as well as the resources to appoint full-time staff. Like Dr. Tripathi said before me, the need for a legal team. It is also very fortunate that the committee is now looking into the creation of sectoral subcommittees, working groups, and so on, to look into dedicated plans for each sector. And while we are talking about the Committee for Air Quality Management, the Commission for Air Quality Management for the NCR region, this also sets a very important precedent for other such similarly polluted regions across the country.
Absolutely, absolutely. That's a very valid point that you're making.
Model,
yes.
The CAQM model is something that can be and ought to be replicated in other polluted parts of the country across different states. And in many of these, the problem areas lie across political boundaries, across state borders, and so on. So we should be looking at the CAQM as a template, which can be therefore be used to resolve air quality in other hotspot regions. Similarly, what Dr. Tripathi spoke about, a separate set of laws for particularly critically polluted areas. And here again, the authority has existed in law for a long time. The Environment Act, the Air Act as well, allows every state or every region to go over and beyond what the center has set out in terms of emission laws, emission standards for individual industries, for transport, like you said. But for a long time, we have seen that the political will to do this has been found lacking. For now, the CAQM represents an independent authority that, at least in law, has the power to take the necessary hard steps to try and resolve the problems of the Delhi NCR airshed.
All right, so we'll also have to see whether this model can be replicated across the country or not. But Dr. Nangia, before we end this conversation, as an individual, what are the safety measures that I can take to combat pollution and avert its health impact?
Very good. I think that's a very, very good question. Rather than blaming the government and the agencies for not doing anything for us, I think there are certain things that we ourselves can do in controlling this air pollution and have our own contribution. So first of all, what we need to understand is that what are the sources of air pollution? The sources of air pollution usually are fossil burning, stubble burning, the vehicular emissions on the roads, then cigarette smoking, and the constant construction and demolition that keeps happening. So these are things that are easily under our control. If there are strict norms on how the construction and demolition has to occur, then there will not be a problem. We need to quit smoking on our own. The government will not enforce that, and government cannot ensure that you quit smoking, but you have to do it on your own. Second thing is we need to keep our environment clean.
Yes.
By reducing the vehicular burden on the streets. So only if necessary, move out, or else stay indoors. Avoid any kind of strenuous physical activity outdoors when the AQI levels are very poor. Wear a mask when you move out. Have more plantations around you. It's also important to control the indoor air. We only attribute pollution to outdoor air, but there's a lot of, in fact, there are some studies which have shown that the indoor air may be 30 to 35 times worse than the outdoor air. So that also needs to be cleaned up. And how can we do that? By not having pets inside the houses, by not having heavy carpets, furnishings which trap dust, avoid lighting up volatile organic compounds, especially agarbattis, dhoops. They contribute a lot to the air pollution. Maintaining the air inside clean by having proper ventilators, by having proper chimneys in the kitchens, and avoiding dampness in the walls. So these are some measures that we all can take to prevent air pollution.
All right, Dr. Nangia, that's a very important message that you're giving to our viewers. Let's not procrastinate. Let's begin today. On that note, as we know that the formation of this commission is expected to bring an end to blame game witnessed in the recent past over the air quality monitoring and management among states of the region and provide for comprehensive air quality management. Thank you so much for joining us, Dr. Nagpure, Dr. Tripathi, Dr. Nangia, and also Mr. Mukerjee. Next week, we'll return with incisive analysis of another important bill. Till then, take care and stay tuned to Sansad TV. Namaskar.